Hello,
Hello.
welcome to Be Well. Thank you for being with us today. I am very excited about the topic that we're going to get into in just a moment, health and well-being and the human-animal bond. I encourage you at any point in time as you desire to comment or ask questions in the chat so you can learn more about this particular topic. We're going to talk about how that human-animal bond improves our physical, social, and emotional lives. I have been fortunate throughout my life to have animals, pets that I cherish. I recognize the joy of this truly unconditional bond and all that it has offered me. But today we'll have the opportunity for our guests to ground that in some particular research and for us to understand those benefits on a larger scale. Taylor, welcome to Be Well today. Thank you for being with us.
Yeah, thanks for having me.
So when we first had the opportunity to connect, I was curious about how you got involved in this profession. So I want to give you an opportunity to share that.
Yeah, absolutely. So I have always been the animal lady. Even when I was very young, rescues tend to find me, and I was fortunate to have parents who allowed that to happen and helped to cultivate that love. So I always knew I wanted to work with animals, but I also really love working with people. So I started off as a dog trainer and did that for many years in the Atlanta area. Still do some dog training now. Went to school to become a mental health therapist, and at that time started to bring my animals with me into practice as therapy animals. But saw that, number one, it was just a very unregulated process. A lot of people didn't know how to get started. And then beyond that, people didn't really know how to describe what was happening. And I wanted it to be a science that was taken seriously. So went on to complete my doctorate in research psychology with a focus on the human-animal bond. And then was just very fortunate to land with Pet Partners, which is a national therapy animal organization, so that I can help to be an advocate for therapy animal work on a large scale.
Now, you're not only with Pet Partners, you're the National Director of AAI Advancement. So share with me what you do in that capacity.
Yes. So AAI stands for Animal Assisted Interventions. And it's just really a fancy term to describe any work that happens with therapy animals. So therapy animals can partner with all different kinds of people. They can partner with professionals, mental health professionals, nurses, occupational therapists, you name it. There's a lot of different professions that work with therapy animals to do animal assisted therapy. Our organization, Pet Partners, has over 10,000 volunteer handlers who go to hospitals, nursing homes, schools, anywhere in their community where people can benefit from the power of the human-animal bond, and they volunteer. That's called animal assisted advancement. So AAI is just that umbrella term. And I work to help support this intervention, again, as something that is scientific. We support research, fund research all over the country and even internationally on therapy animals. And I help to design studies and recruit participants. And we also talk a lot about making sure that high standards are represented in the literature. So at Pet Partners, there's a lot of steps that a person has to take to become a registered therapy animal team. So we champion those. And then I also work to support those professionals who bring therapy animals into practice. We're actually launching a professional association for them next year.
That's fantastic. I don't know if I said as a preface that you're coming to us from Georgia and that you've created your own maybe informal research setting there. And so you do have a few pets, don't you?
I do, a few. I do joke with people often that I have all of these fancy ways to describe why I'm in this field, but really I wanted to be able to have as many pets as possible and it be socially acceptable. So I thought if I got my PhD, that would help. So with that in mind, I have 9 dogs and 3 cats. Most of them are working dogs, or they were therapy animals. Some of them have retired. They worked long careers and are just old and lazy and spoiled now. Some are active therapy animals, and I have now a few who are in training. We do have rules at Pet Partners about not overworking animals. So when I was a full-time therapist working 40 hours a week, you can imagine I needed a lot of animals. And now, slippery slope. They find their way to me, and we have a happy life here out on a bunch of land in Northeast Georgia.
Well, you've stated very well how you qualified your team that you have there. So
Yes.
That's fantastic. So if you will, start us down the path, Taylor, in terms of what are some of the benefits related to having a pet?
Yeah, there are so many benefits, and there is a lot of great science out there, which I'll touch on. But I think it's also important to keep in mind that we're just now scratching the surface and really understanding what our pets can do for us. There is science to support that having pets in our lives helps us physically. We have lower blood pressure, healthier heart rate. There was a study about people who owned cats had a 40, or people who did not own cats, I'm sorry, had a 40% greater chance of dying of a heart attack. Now, of course, we're not saying the cat is causing, this correlation, but there is certainly a correlation there that's worth looking at. And we tend to walk more, we're more active. When COVID first hit and we were all trapped in our homes, we heard so many of our handlers talk about how, they were really depressed and found themselves just laying around on the sofas, and the dogs would be like, get up, we're going for a walk. I don't know what's going on in your world, but in my world, I still want to go out and see things and be active. So it helps in that way. Emotionally, when children are growing up in a home with pets, they tend to learn empathy skills and caretaking skills. They can model this attachment that's so important. Socially, they foster connection. They get us out and talking to other people in the community. So there are so many different studies looking all of these different individual aspects of physical, mental, emotional health, and pets have been found to help in all of those.
You've done a wonderful job of kind of giving us the litany of the physical, emotional, social, psychological. And I, to your point, I think about when we moved to a new neighborhood and just walking in the neighborhood with a new puppy and how that bridges meeting people, and just it opens up this level of engagement that wouldn't happen if you were just walking down the street without a puppy or an animal. So it's fascinating to see the reactivity of having a pet. As well as, to your point, in terms of different settings. I think of with seniors to children, just the opportunity for, as you said, socialization, a certain level of endearment and nurturing that goes on. So as you speak to the therapy animal, tell us a little bit about the process of having a therapy animal, what one needs to do to get to that stage, and the application of where therapy animals are today.
Yeah, so therapy animals are pets who are owned by people. So at the end of the day, they're just beloved pets like all other pets, but they are specially trained and evaluated to go out and share their love with the community. So you might see a vest on an animal, and there's a lot of understandable confusion. Is this a therapy animal or a service animal? They're two different things. A service animal is working, they're on the other end of the leash of the person who they are serving. So a service animal might help someone who is blind, or someone who has seizures, and they're going to detect those. So we don't talk to service animals or pet them in public because they need to work. Therapy animals, on the other hand, oftentimes I'm out with my dogs and people see the vest and there's that initial hesitance, like, can I touch him? And I say, he is a therapy animal. He would be the world's worst service animal because he does not care about me right now. He wants to talk to you. He wants to meet anyone and everyone. And that's what therapy animals do. So we really look for them to be, we use the word affiliative, meaning they like to meet new people. They tend to be, in my experience, a bit more boisterous and confident. And, we are in a hospital and a siren might go off and my dogs just don't care, it doesn't bother them. But on the flip side of that, they can sometimes be a little bit more challenging to train. So anyone who has a pet, who has that affiliative nature, who has some basic training so that, they're well behaved in public, would be a candidate to become a therapy animal. And it's not just dogs. They're our most common. 98% of our animals at Pet Partners are dogs, but we actually have 9 different species of therapy animals: cats, horses, llamas, alpacas, rabbits, pigs, guinea pigs, rats, birds. I think that's all of them. So any of those animals who like meeting new people would be eligible for our program.
So I may think I have a dog, a puppy, and now a dog that would be affiliated. How would I know? Is there a process that we would go through?
Yes, absolutely. So if someone's interested in becoming registered with their animal, the first step, you could go to petpartners.org and there's more information. But the first step is an online course. There are in-person courses too, but right now with COVID, they're a bit limited, that teach you more just about the intervention. But then there's an evaluation with your animal that almost mimics what you would see in a visitation setting. So multiple people coming up and surrounding your animal at once, or your animal's reaction to certain medical equipment or loud noises. And so you have that test built into the process, but an informal test is really if there's a dog-friendly store in your community, to go out and see how your animal approaches other people. Are they scared? Are they happy? What do they think about all the noises? And if they are one of those animals who really likes to go to the store with you, then they're probably a good chance that they would get a good therapy animal.
And you touched on something that has been an interesting observation more recently, I think more recently, that culturally it seems like there's a greater acceptance to bringing your pet to the settings that you're alluding to, going to the store, going to retail stores, going to restaurants and having your dog or cat or pet to be with you. And so culturally, that seems to be a significant shift. And I just wonder if you have commentary on that.
Yeah, we see it more and more now. I think people are realizing, especially after COVID, there's a lot of conversation, even in workplaces, about being more pet friendly, which we love and we're a big fan of. I think people know, pets are just a huge part of our lives, and sometimes they can be really fun to have in different environments. With that being said, though, we are also such strong advocates for animal welfare, and we know that not all animals like to go all places. I actually now, even some of my dogs who are working therapy animals and would love to go places years ago are tired now. When I'm like, do you want to go somewhere? They look at me like, meh, I'd rather just kind of stay home and rest. So we always encourage people to really monitor your animal's behavior. You know your animal best. Are they happy? Are they stressed? And so only really taking them to places that they enjoy is an important part of that.
The other thing I've seen is kind of like a wink and nod process that when someone asks, can I bring my dog into this restaurant or into this setting? And they said, well, if if your pet's a therapy pet. And so I just wonder what you have to say about, I know some of that's unregulated and
Yeah, it is. And there's a lot of misinformation. So therapy animals are actually not allowed special access anywhere. Service animals are. And so we teach our teams at Pet Partners to never misrepresent their animals and to be very clear if you're going into a place what the animal is, and ask for permission based on that, because we really want to respect the fact that people with service animals need that space. If someone puts a vest on an animal and brings them to a public place and it goes wrong, it could be very bad for the people who have service animals who really, really need them out in places. And we've heard stories of like service animals getting attacked by dogs who are not supposed to be out in public settings. So we want to be really respectful of that. But, we find so many places now are open to pet policies, or if you tell them what the animals they're doing, that they're a therapy animal, or even if the pet-friendly restaurants and bars and stores that are around these days, there's a place you can probably find to take your pet with you if you want.
Well, I appreciate the advocacy work that Pet Partners is doing to have particular standards, because I do think there has been kind of a swing where even airlines, would allow pet therapy, pet service dogs, and now it's kind of swung back a little bit where it's being more, there's greater oversight around that. Now, Taylor, I know in your capacity, you're involved with a lot of research institutions. And you cited for me a little bit earlier all the different universities and doctors that you're working with and scientists, so to speak, in those fields. What is the research that's being underfoot at this point?
Yeah, so we are really fortunate. We have at Pet Partners a human-animal bond advisory board with researchers from all around the world, really. And they're at most universities. There's someone who's interested in human-animal interaction. So research is going on. Right now, we're really shifting focus to look at animal welfare in therapy animal work, to encourage people to think about, these animals are not tools that we're using. They're feeling beings, and making sure that we're respecting that. we're shifting at looking at how to standardize this in research. So we often talk about, we know it makes people feel better to be around a therapy animal, but how long do they need to be around? For how long? What's the treatment like? So that it's just a bit more clear for professionals what they should be doing when they're working with animals. And we're also really, really passionate about trying to increase diverse representation in the human animal space. So human animal interaction cross-culturally, and for many different populations that we historically haven't served as much. So I used to work, for example, in the state of Georgia, in the juvenile justice system, and I loved that work there. And so we're really looking at researching the intervention in places like that, whereas for so long, the focus has been on therapy animals in hospitals, which is great, but we want to learn just in more settings, what these animals can do.
You and I spoke a little bit earlier related to pet therapy, and you were saying that the needs for people in this space is tremendous. What can you say about that?
Yes, we have historically, for as long as we've been around, have had the problem of not being able to keep up with requests for therapy animal visits. Sometimes our handlers will say it can be a bit hard to get buy-in initially. You have to tell people what you're doing and show them the standards and the evaluation so people know it's something to be taken seriously. But once a therapy animal visit happens in a facility, you would not believe how often they request it. The patients, the staff, doctors. So we see just this huge request come in. And after COVID, especially, so many of our handlers, you think, now we're about 2 years, a year and a half of time being challenged. Animals age out quickly. So a lot of our most active handlers back before this whole madness started, their animals might not be able to return to work. And so as we're looking towards this new normal and being able to go back into the places we used to visit, we really, really need more therapy animal teams to join us. And even if you can only visit for an hour a month somewhere, it's a place where you choose. You really, once you become a volunteer, you get to pick where in your community you want to go. We need more people who are willing to share the love of their animals in the community.
So I know the applications are vast, but if I was to just ask you to highlight those settings where pet therapy is being employed and where the needs are at this point, so someone would have an idea if they're considering these are things that the opportunity.
Yeah, absolutely. I would say our most common places that people visit are going to be hospitals, senior living homes, schools. We have library programs where kids practice reading to dogs, juvenile justice settings, or just justice settings in particular. We have domestic violence shelters. So we also have corporate visits. So we have people who go out and just help. People are doing pretty well at a local business, but there's a stressful time coming, and so they go out and visit there. We have crisis response teams who have a second level of training. If an emergency happens or a crisis in a community, it's really impactful to allow the therapy animal teams to go out. So anywhere you're welcome. As a volunteer, you're allowed to go with your animals. So it can look like anything to match your interest.
That's wonderful. I was interested in, you had shared something about virtual opportunities and the impact virtually. And I thought I was fascinated by that.
Yes, this is a field that took off unexpectedly with COVID. And so we saw this very interesting thing happen when this all hit. A lot of our teams have been visiting the same facilities for years. So they had well-established relationships, maybe with people, for example, at senior living facilities. And so when these visits stopped, it was hard not only on the people who were receiving visits, but the teams and the animals missed the people who they went and saw. So they started to do things like video calls or send pictures, but even things like animal coloring books started to be born. And so this whole new field, we call it animal related engagement, was born, where we just share the love of animals in a way when we can't have face-to-face interactions. And so we ended up getting a Facebook page where our handlers could put their content, and thousands of facilities all around the world would go. So nurses could say, have you seen this today? A cute little video to make you feel better. And I think that's something that will continue post-COVID. So even if your animal can't be a therapy animal, but you have a gift for getting cute content, then that's something that you can do is share that cute animal related content in your community to make people feel better.
Oh, I love hearing about that. That is wonderful. I appreciate the work that's being done. As you said, the research is pivoting a little bit more towards animal welfare. And I know during the pandemic, with people being at home, a lot of people were looking at having a pet. And so if you were to give a primer, so to speak, on how to determine if you're ready to have a pet, just so, again, for the welfare of that pet, that it's the right setting.
Yeah, it's something that's so important because we see so many people and we saw so many people during the COVID pandemic like the idea of having a pet, but then when you have one in your home, it can be very different. And so I always say, if you're on the fence, a really good place to start is fostering, because then you can try having a pet in your home for a while and then, no commitment. But I'm also very serious about encouraging people to think about the energy level of the pet that they're going to get, and doing some research, especially on if it's a dog, on the breed. So as a dog trainer, I can't tell you how many times people would say, I want a German Shepherd. And I'd say, have you ever met a German Shepherd? I love them, but make sure you know what you're getting. My standard poodles are very, very intelligent. And I joke, I left them with my dad at one point when I went on a work trip, and he called me like the next day and was like, you gotta come home. They're turning on my faucet. They're getting in the fridge. I said, yeah, it's a standard poodle. So really make sure you know what you're getting with your breed, and try to get an energy that matches yours so that it will be the best success.
That's a great example. I think about more recently our puppy Winston, who's a golden doodle, and he's just like a little human, and you feel like he should be talking back with us. I mean, he tilts his head, and
Yeah.
like a dialogue that's unspoken on his end, but it feels like there is a communication going on there.
Yes, they pick up on way more than we think. And so it is funny how different breeds will take you by surprise. My laziest of all is my 130-pound Irish Wolfhound. And so, just you might have a look that you like in an animal, but ask someone who owns one or do some research to find out if it's a good fit.
So Taylor, I really appreciate your time today. Anything you want to share with us in closing? I know we're going to have some links for resources. If you can kind of share what those are so people know how to access, but anything else that you'd like to share with us in closing?
Yeah, we'll share the link to petpartners.org, where you can find all different kind of information. We also have free publications like white papers that go over just a high level benefit of the human animal bond, if that's something of interest to you. But I would just encourage anyone who has animals in their life to think about at the end of each day. It sounds cheesy, but I really love that saying, I'm going to be the person my dog thinks I am. And so the animals they have such positive regard for people. They tend to love everyone they see. They're so resilient. And so it's just my mission to be more like them in a lot of ways. And I hope to get a lot of other people to buy into that as well.
That's a great standard that you just shared in that quote. I love that. Thank you, Taylor, for the work you're doing. Thank you for sharing the resources and all this information. So I really appreciate it.
Absolutely. My pleasure. Thanks for having me.
And everyone else, please be well until we're together again, and have a wonderful day. Thank you.